Hi, I'm Cheyenne and I'm one of the writers for this blog. Today I'm going to be giving you a brief overview of what we discussed in our last post concerning ADHD or attention deficit hyperactivity disorder, as well as giving you an overview of what we're going to be covering in this blog post. So in our last post, we discussed key characteristics of ADHD, such as a lack of attention or focus, restlessness and fidgeting that's persistent over time, as well as impulsive behaviors. Some characteristics where these symptoms can come out on is children who have this have a difficulty monitoring their time and using their time wisely. They're often late and don't realize that they're late. Restlessness, we see this a lot in classrooms. The classroom is very difficult for children with ADHD to sit still and to focus on their own work, so they're often fidgeting. As well as impulsive behavior, that would be sometimes it's seen as aggressive towards other children or picking on other children, and general rowdiness where they're not able to control their behavior, which also adds to their restlessness and fidgeting. So those were some of the things that we discussed more in depth in our last post. So if you'd like to know more about those things, go ahead and scroll back and you can read that. In our post today, we're going to be going over some strategies and techniques for how to help children, specifically as parents, how parents can help children with ADHD. So we're going to be focusing on peer-reviewed research in this post, and there will be two main research studies that we're going to be pulling our information from. The first one is a socio-emotional approach, which means it's a social, so peer interaction approach, as well, or I guess combined with an emotional approach. So that's the first one that we're going to be going into a little bit more depth about and learning about. And the second one is a mindfulness-based approach, which is kind of like meditation and relaxing your body and focusing on breathing. So both of those are going to be the main information that we're going to be sharing in this post, as well as a few more general techniques or things that can be helpful to parents. There are a lot of videos in this post because there's a lot of unfamiliar topics that the research study goes into. So if you're interested, there's several videos, there's some ponder questions to help enhance what you're learning and how to apply it to yourself. And we just wanted to remind everyone that throughout this blog post, we don't intend to be giving medical advice or counsel, so we hope that it's not taken that way. Nothing that is in these blog posts should be taken as a diagnosis or as medical counsel. So we always encourage you to talk to your doctor specifically about your child or any other concerns or questions that you have. We really appreciate everybody who's been looking into these blog posts and participating and sharing, and we really encourage that because that helps us with our understanding and learning, as well as knowing what else you guys would like to know about. Again, this is for a class, a practicum class at BYU, Idaho, and we appreciate any interaction that you guys can give us. Thank you so much for watching.